Thank you, Mr. Balram.
Mr. Rao, first of all, congratulations on winning the prestigious Namma Bengaluru Award.
Thank you.
Mr. Rao, there are several homes for the aged in Bangalore. What is so unique about Karunashraya?
Well, the uniqueness of our care is not really directly connected with the age only. All we look for really is to help those people who have had cancer and who have gone through their curative treatment stage, and when that treatment stage is over and when the doctors feel that from the curative point of view there is no further avenue for care, it's at that time that we come into the picture. So, that indicates that it's not only the aged who come to us, it's those people who have had that stage of the disease. So, it could be somebody quite young, it could be somebody middle aged, or it could be somebody fairly old. The range of our care has been from age 2 years, a child of 2 years, running right through life, and the oldest patient we have had is 97 years old. The only criterion, as I said before, was that we take them on after they have gone through their curative stage in cancer, and we look after them from there onwards.
Mr. Rao, did any particular incident in your life motivated you to start Karunashraya? Apart from you, who else were founders of this home? Who else were founders of this home?
Yeah. Well, my mother had died of cancer in 1963, and since then perhaps it was at the back of my mind that I should do something for cancer patients. But pursuing a commercial career like mine, which was trying in all ways, with travel, with a lot of heavy work, etc., I didn't get much time to work for the cancer cause till I was about 48 or 49 years old. After that, while I was still pursuing my career, I began to do some work for cancer by opening a branch of the Indian Cancer Society here in Bangalore. Once that was opened, I started doing a lot of work for cancer awareness in the city of Bangalore, in the slums, among clubs, in schools, colleges, etc. And it was in that awareness work for the Indian Cancer Society that the government of Karnataka invited me to be on the governing council of Kidwai, the local cancer center. And in that center, which I used to visit every month, sometimes twice a month, that I came across a part of the disease that was not being addressed by anybody. The curative part was being taken care of by Kidwai and many other hospitals, but when the stage was reached where there was no more hope for cure, the patient was at a loose end, didn't know what to do. He would suddenly lose the comfort of the hospital, the support of the hospital and the doctors, and he would go home only to suffer till the end came. Now, that could be a week, 10 days, 15 days, a few months maybe, but that stage of life nobody was addressing. And that's how this whole idea of palliative care for cancer patients came up.
So, this is palliative care.
This is palliative
because
care.
Not many people seem to know about this particular name, palliative care.
Yeah. Palliative care is what we offer at that stage of the disease. And going back to how the organization started, in the Indian Cancer Society, we were only 3 or 4 professionals like me working somewhere, doing work for cancer in our own spare time, on weekends, etc. So, we didn't have that sort of manpower to help us, to back us up for our work. And when this project came into my mind and I envisaged it as a large project running into perhaps some crores of rupees, and for an organization which was a purely charitable organization, we had to look around for support from elsewhere. That's how the Indian Cancer Society got supported by one of the Rotary clubs, one of the active Rotary clubs here in Bangalore, Rotary Club of Bangalore, Indiranagar, and they joined us in working for the cause. So, that's where we set up a public charitable trust with the Indian Cancer Society and the Rotary Club joining up together to make this happen. So, it is these people also who helped us right from the beginning to make this project succeed. So it is not only me who started this, but there were several others who were sold on the cause, who did not very much know about palliative care till then, until we sat down and discussed it, and where we sold the cause to them, and they were equally impressed with doing something for those poor suffering people who had no help at that stage of life. So that's how the whole project started up.
Mr. Rao, do you just ensure that they live decently till death, or do you provide good medical care so that they show improvement? And if they improve, will you send them back home?
Yeah. Well, palliative care really is not just the medical part of it. Certainly the medical part of it comes through. I used to keep on saying that the medical part is only 50% of our care, but our chairman, who's a doctor, often corrects me to say that no, it's only 40% medical and the rest 60% is other types of care. Now, what are these other types of care? The other types of care run into counseling, into trying to find out what the difficulties of the patient are, trying to address that, trying to involve the family in the whole part of care, and putting the whole family as a unit and taking care of that unit of care, which covers the whole patient and the entire family. Now, why is it necessary to cover the family also in this sort of care? I'll give you one example, one or two examples of the cancer patient who is at this stage of his life. He could be a person maybe in his middle age, still working somewhere. He could be working for a public sector undertaking here in Bangalore. He could be living in the quarters of the public sector undertaking. He, without warning, cancer strikes. He goes through the curative state and he knows that he is coming to the end of life. That is the time his worry starts, not only about this disease and the pain or the other symptoms, but the other problems also. He's not yet built a house, he's not yet got a place to live in. When he dies, where does the family go? He's got a young daughter maybe, the daughter is yet to be married, so he hasn't arranged for that yet, not anticipating this sort of an end. A son who is not yet settled in life, he hasn't finished his studies. So these are all the concerns that come to a cancer patient at this stage of life. It becomes a traumatic situation for him as well as for the family. I told you what the patient goes through, but look at it from the other side of the coin, the family side. The son is greatly worried because after his father dies, who will complete his studies? The daughter is completely at a loss and the wife is a shattered person. So all these four people within the family have great trauma and they come to us in that traumatic condition. So what we do is that we address the entire trauma of the whole family. So I said 40% of his of palliative care is medical, and the other 60% of it is other than medical. It's counseling, addressing the concerns of the family, etc. We begin to counsel not just the patient, but also the family. Now, the patient has a dual sort of concern. One is that he's going to die, so that has to be addressed. The second is the family situation which I just described. So that has got to be addressed. There have been times when a youngish mother is facing the end and she's greatly troubled because of her family circumstances or whatever it is. She's worried that her young children will not be looked after. Part of our care also includes going around looking for an orphanage or looking around for a home where the children can be placed. And once the children are placed, the lady is very much comforted and she dies in peace. So these are some of the types of care that we need to give. So it's not just the medical part, it's the complete care, and that complete care is called palliative care.
Mr. Rao, what kind of patients you get apart from the terminally ill cancer patients? Is it only terminally ill cancer patients or anyone else also?
Well, I wouldn't call them terminal. In fact, that I think is a bit of a misnomer. They might be, the curative part of the treatment might be over, but they've not been declared terminal in the sense the doctors don't say that he's going to die in 2 days' time or anything of the sort. But the curative treatment being over, the rest of the care starts up. Very often cancer patients end up with severe pain. They might be vomiting, they might have swellings, they might be constipated, they might be purging. All these are symptoms which need to be addressed. So it is not just that they are terminal in their stage. They could be, the end might be quite far off also.
Mr. Rao, what I am saying is, do you treat only cancer patients or anybody else who are on their deathbed?
No, we started this hospice, it's called a hospice incidentally, and we started this hospice only for cancer patients. And we started it knowing that we would be treating a lot of very poor people. And it is because we were very focused on the disease of cancer that we started giving this sort of care in that. Now, there are various other diseases also which take the life of a patient. Now, we reasoned it out that if we start addressing everything, then our care might not become as effective as it should be. So, we had a very narrow, straight focus of cancer. So, right now we are only looking at cancer, but we have other plans also